Now I would be giving an explanation of how to examine the cranial nerves. We test the optic nerve to see the acuity of vision, color vision, and field of vision. To test acuity, the Snellen's chart is used. The patient views the chart from a distance of 6 meters or 20 feet. The number below each line on the chart is the distance at which a person with normal vision can see that line. Each eye is tested separately. The normal vision is 6 by 6. So 6 by 24 indicates the patient can read at 6 meters letters which a normal eye can read at 24 meters. So James, now I need to take your specs out. Yeah, take your specs out. Yeah. Now you cover your left eye. Can you read any lines?
No.
You can't read anything?
No.
Right. Can you count my fingers?
4.
Right. Can you cover your right eye now? Can you read anything?
No.
Can you count my fingers?
4.
That's good. Now can you put on your specs now? Cover your left eye. Can you read now?
Yes.
Which is the last line you can read?
Line number 8.
Can you read it for me?
DEFPOTEC.
Very good. Now can you cover the other eye? Can you read now?
Yes.
Which is the last line you can read?
Line number 8.
Yeah. Can you read it?
DEFPOTEC.
That's very good. James here can't read without specs. He can count my fingers, but with specs he can read, and his corrected vision is 6 by 6 in both his eyes. Color vision is tested using Ishihara plates. Embedded in the pattern with colored spots is a number. The patient has to identify the number, and if color vision is abnormal, the patient is called colorblind, and the number is invisible to him, and the plate appears uniform. So James, now I want to test your color vision, right? So I want you to read the numbers which are given on this book, okay?
1574.
That's very good. Testing of visual fields is done by the confrontation method. The normal visual field is 180 degrees on each side and 80 degree up and down. You are comparing your own visual fields with that of the patient. Keeping both eyes open, waggle both your hands in the upper and lower fields of vision. If the patient detects only one hand movement, then he is suffering from sensory inattention, which is a cortical dysfunction. Then cover each eye in turns and repeat the testing in each of the visual fields, that is upper right and left quadrants and lower right and left quadrants. Visual field loss can be anywhere or any problems between the optic nerve up till the cerebral cortex. Refer to the photograph for further information. So James, now you need to take out your specs. Yeah, and I'll be wriggling my fingers, right? So you tell me when you can see that, right?
Now. 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 Now.
Can you cover your left eye?
Now. 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 Now.
Can you cover your right eye?
Now. 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 Now.
Good. Complete the visual examination with an ophthalmoscope by looking at the fundus. Inspect the eyes for drooping of the eyelid in third nerve palsy. Inspect the pupils for the size in millimeter, the shape, and whether they are equal or not. Check the eyes for nystagmus and squint. Now I will be checking for accommodation. The afferent for accommodation is the second nerve and the efferent is the third nerve. When you are looking at a distance and then suddenly have to look at an image which is close by, you are using accommodation, and what happens is that there is a pupillary constriction, convergence of the pupils, and increase in the curvature of the lens. We test the pupillary reflexes by shining a torch from the side onto the pupil. Each eye is tested individually and both the pupils are examined. When the light is shone on the right eye, the right pupil constricts as well as the left pupil. The right pupil constricts because of the direct pupillary reflex and the left pupil constricts because of the consensual or indirect pupillary reflex. The third, fourth, sixth nerves are tested together as they supply the muscles that move the eye. The eye movements are tested with the help of the edge test. An edge pattern is made in front of the patient with the patient sitting across you at a distance of 40 centimeters. The patient is told to follow the movement of your finger or pen without moving the head. Look at the eyes as they follow your pen or your finger and see whether there is any lag of any eye behind. Ask them for double vision at any point during this exercise. The fifth nerve is a mixed nerve. Check for the sensation of touch and pain in the areas covered by the three branches of the nerve, that is ophthalmic, maxillary, and mandibular. Compare the sensations on both the sides. You would expect the mandibular branch to be involved in the fracture of a jaw or some dental problems. The ophthalmic branch would be vulnerable in orbital tumors or infections. Check the motor part of the nerve by clenching the teeth. That tests the temporalis muscle as well as the masseter muscles. Test the lateral pterygoids by depression of the jaw against resistance. Perform the jaw jerk reflex. Normally, the reflex is either slight or absent. Abnormal masters would jerk the mandible up, and therefore an abnormal jaw reflex would be an increase in the jaw jerk reflex. The corneal reflex, which tests both the fifth and the seventh nerve, is not commonly done, and it is discussed at a later part of the video. The seventh nerve is a mixed nerve. The sensory is taste from the anterior two-thirds of the tongue, which is not tested normally. Inspect the face for the symmetry, angle of mouth, angle of eyes, presence of wrinkles, and also the nasolabial folds. Ask the patient for hyperacusis, as the stapedius is supplied by the seventh nerve, and this helps to dampen the sounds. Test the motor function by doing voluntary facial movements like wrinkling of the brow, showing the teeth, blowing out the cheek, etc. In Bell's palsy, which is a lower motor neuron type of paralysis, whole half of the face is involved. In upper motor neuron paralysis, as in stroke or infarction of the internal capsule, only the lower half of the face is involved. So James, now I'm going to ask you something. Do you hear louder in any of your ears? No. Can you raise your eyebrows? Good. Can you close your eyes and tightly so that I can't open them? Good. Can you puff up your cheeks? Yes. Can you whistle? Yes. Can you smile? That's good. Hearing is tested with the whisper test for lateralization first. You whisper on each ear of the patient and ask them to identify the word or a number. If one of the ears has a problem, then we further test as to whether this hearing loss is due to sensory or conductive defect. The Rennie's test is used to distinguish between sensory and conductive hearing loss. A tuning fork is struck and then placed either on the mastoid to test for bone conduction and in front of the ear to test for air conduction, and then check which of the sounds is better one. If the air conduction is more than bone conduction, this indicates either a normal ear or a sensory neuronal loss. If bone conduction is more than air conduction, we say that Rennie's is negative, and this would indicate that probably the deafness is due to a conductive hearing loss. We further do a Weber's test to distinguish between sensory and conductive hearing loss. Here, the tuning fork is struck and placed on the forehead, and the patient is asked to assess the hearing in both the ears. Normally, both ears should hear equally. In sensory loss, the buzzing would be less in the affected ear. So James, now I'm going to test your ears, right? Can you hear properly? Yeah. Can you shut your left ear? Wonderful.
Wonderful.
Can you shut your right ear?
Special.
That's very good. Now James, what I'm going to do is I'm going to make this buzz, right, and place it in front of your ear and behind your ear. And I'm going to ask you some questions, right? Can you hear? Which is louder?
The one in front of the ear.
Right. Can you hear? Which is louder?
The one in front of the ear.
Right. Now I'm going to make it vibrate again and place it in the center of your forehead. And I'm going to ask you which ear you can hear better, or whether you can hear it equally in both the ears, right?
It is equal.
That's very good. The 9th and 10th nerves are tested together. The 9th is the sensory and 10th is the motor. The patient is asked to say ah, and we watch the movement of the palate and the uvula. The palate normally rises, the uvula is central and does not deviate. The gag reflex is not usually done. The cuff reflex may be tested, and the sound of the cuff may be abnormal if the vagus nerve is involved. So James, can you swallow for me? Can you cough out? Can you open your mouth? Can you say ah? The shoulders are examined for asymmetry. The sternocleidomastoid and the trapezius are then tested for their motor powers. Remember, when you ask the patient to turn the head, remember that the right sternocleidomastoid turns the head to the left. So when the patient is looking to the right, you're testing the left sternocleidomastoid. The trapezius is tested by placing your hand over the shoulders and asking the patient to shrug.
Yeah, James, can you push my hands upwards? Yeah, good. Now, James, can you push my right hand? Can you push my left hand now?
To test the 12th nerve, look at the tongue for wasting, fasciculations, any deviation from the center. Wasting and fasciculations are seen in lower motor neuron lesions. The tongue usually deviates to side of the lesion. Test his speech by asking him to repeat a small word.
So, James, can you show me your tongue? Yeah, good. Can you push with your tongue my fingers? Again. Yeah. Can you say la 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 5 times?
La, 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 la.